What if I told you that in 1934, 16 people were handed a death sentence by their doctors, and 90 days later, every single one of them walked out cured? Not in remission, not stable, cured. The treatment took 3 minutes. It cost almost nothing. It worked on every patient, every time. And the man who invented it was erased. His laboratory was destroyed. His colleagues went silent. His name was removed, paper by paper, journal by journal, from the official record of science. By the time he died, most of America had never heard of him. Most of America still hasn't, until now. His name was Royal Raymond Rife, born in 1888 in Elkhart, Indiana. Not a doctor, not a professor. He was something rarer. A man who understood machines the way most people understand language, intuitively, completely. He studied optics, electronics, biochemistry, and radiochemistry almost entirely on his own. He worked for the US government. He held 14 major scientific awards. He received an honorary doctorate from the University of Heidelberg. And yet, outside of certain research circles, nobody knew his name, because Rife wasn't interested in recognition. He was interested in a single question that had consumed him since 1920. What if every disease had a frequency? Not a chemical, not a drug, a frequency, a specific, measurable vibration, the exact pitch at which a pathogen exists. And what if you could find that frequency and turn it against the organism itself? Think about what happens when an opera singer hits the exact resonant frequency of a crystal glass. The glass doesn't crack, it doesn't chip, it shatters. Rife called it the mortal oscillatory rate, and for 20 years he hunted for it, one pathogen at a time. In 1933, Rife completed what he called the Universal Microscope. It was unlike anything ever built. It could magnify objects up to 60,000 times, 10 times more powerful than any microscope in existence. Using a prismatic light system that bent wavelengths without destroying the specimen beneath, Rife became the first human being in history to observe a living virus in real time. Let that land for a moment. Before Royal Rife, no one had ever watched a virus live. Every other microscope killed the specimen in the process of illuminating it. Rife watched them move, and inside cancer tissue, every sample, from every patient, every single time. He found the same organism. He called it the BX virus. When he exposed it to a specific electromagnetic frequency, it burst, not weakened, not disrupted, destroyed. By 1934, Rife and a committee of doctors affiliated with the University of Southern California had taken this finding from the laboratory into a clinical setting. 16 patients, all terminal, all told by their physicians that nothing more could be done. The treatment lasted 3 minutes per session. The patient would rest for 3 days, allowing the lymphatic system to clear the destroyed cells and then return. No pain, no side effects, no radiation, no surgery. After 90 days, the committee reviewed the results. 16 patients entered the trial. 16 patients were declared cancer-free. A banquet was thrown in Rife's honor, attended by 34 of the most respected physicians in America. They gave it a name: the end to all diseases. Then something shifted. Morris Fishbein was the most powerful man in American medicine. He ran the American Medical Association, controlled what got published in its journals, and had spent decades building an empire around pharmaceutical-based treatment. Fishbein approached Rife. He wanted to buy the rights to the frequency instrument. Rife refused. What followed reads less like a scientific dispute and more like a crime novel. Dr. Milbank Johnson, former president of the Southern California AMA, one of Rife's most powerful allies, was poisoned on the eve of a press conference announcing the 1934 results. His papers disappeared. Dr. Nemes, who had independently replicated Rife's work, died in a laboratory fire that destroyed all of his research. The Burnett Laboratory, also in the process of validating Rife's findings, burned to the ground as well. Rife's own lab was broken into. Equipment was sabotaged. Critical components vanished. His colleague, John Crane, spent years helping Rife rebuild the frequency instruments and document the work. In 1961, Crane was arrested. His equipment was seized and destroyed by court order. He served 3 years in prison, not for harming anyone, but for practicing medicine outside the pharmaceutical framework. And then came the quietest part of the erasure. No explosion, no raid, just silence. Paper by paper, reference by reference, Rife's name began disappearing from the journals where it had once appeared. Colleagues stopped returning his letters. Institutions that had praised his microscope stopped acknowledging it existed. By the early 1950s, Royal Rife had been effectively deleted from the official history of American medicine. By the 1950s, the man who had built the most advanced optical instrument in human history was living in near total obscurity, increasingly dependent on alcohol to get through the day. Nobody called, nobody published, nobody came. In 1971, Royal Rife died at Grossmont Hospital in California. The official cause of death was listed as heart failure. Some accounts suggest he was administered a lethal dose of Valium at the same hospital that had been attempting to gain access to his remaining research notes in the weeks before his death. We cannot confirm that. What we can confirm is this: the Universal Microscope still exists. Multiple units, in fact, held in private collections and research archives. Scientists who have physically examined them have confirmed they are unlike any other optical instrument ever constructed. Their internal light-bending principles have never been fully explained. They have never been successfully replicated. The Smithsonian Institution published a description of one in its annual report in 1944, and then, like nearly everything connected to Rife, that mention quietly faded from the record. Here is what makes the Rife story different from most of what you'll find in the suppressed history files. We are not asking you to believe that he definitively cured cancer. We're asking you to look at what happened when he tried to prove it, the labs that burned, the colleagues who died, the documents that vanished, the institutional silence that descended, not gradually, but suddenly, within a few years of a successful clinical trial. Ask yourself if the science was simply wrong, if Rife was simply mistaken. Why not say so? Why not publish a rebuttal? Why not run a counter-study? Bad science gets ignored, it gets laughed at, it gets corrected in print, it does not get erased, and it certainly doesn't come with fires, poisonings, and arrests. History is not always lost by accident. Sometimes it is removed by people who knew exactly what they were removing, and exactly why. Was Royal Rife a suppressed genius, a sincere scientist whose unverified work was justifiably buried? Something in between? That question is yours to answer. But before you do, consider this: the most dangerous files are never the ones that were destroyed, they're the ones that were almost remembered. Pause. This has been the Hidden History Files. If you want to go deeper, the link to the next file is on your screen right now. And if this is the first file you've opened, it won't be your last.